from. We'd love to connect with you as well. And let's see, I think we have our President Ezewine of Osiri University, Dr. Maracha Mugu, who just joined us here as well on the panel. Okay, let me ask you a little bit more a background question. When did you move to the US exactly? And what was the experience like taking that board exam to transition, if I may, from practicing in Nigeria to being able to practice in the US?
Well, when I was practicing in Nigeria, because I hate to see when someone died from preventable illness. It beat my imaginations to see people dying of something it can prevent, or it can treat. But because of a lack of health information, just like we're about to talk about sickle cell anemia today, to create more awareness, I mean, it doesn't take much to save a life, like I keep telling people, So when I look back, I was like, I don't see a reason why I should be practicing Nigeria, why I'm practicing here, I don't have joy, not that I'm not financial joy actually, but, sometimes you feel like you can do this, but there's no equipment in the country for you to perform that. You feel that you can do this maneuver to save a life, but, management keep telling you that, oh, there is no, the equipment is down, there's no money to repair, there's no fund. Whereas you're seeing the fund moving around, and the fund is going into someone's pocket. I was like, no, I was not born to live in this kind of environment or practice in this kind of environment, So I decided to start coming, I'll come to the state to write my board exam, I'll go back, So I was doing this, came back, I was like, okay, you know what, let me not stay back here since I've decided to stay. And my wife was like, okay, we have to stay here because she will not be comfortable to stay in Nigeria, I said, okay, fine. Let's stay back, since this is where I want to stay and, practice. But that won't stop me from giving back to the community because my aim is for us to go back one day and put that country in order.
That's beautiful. Dr. Islam, please go ahead and unmute yourself if you want to chime in at any time. I just want to remind for those of you who are watching, if you are an African who lives in the diaspora, who lives in the US and Europe, understand that it is your duty to learn and go back home to develop home, to contribute back at home. It is your responsibility. I always say that as African people, we have two roles. One, take care of ourselves and family, but also take care of our community. We have to do those two. Our ancestors have cleared the way. They've paid the price with their sweat and their blood and their lives in many cases for us to be able to do some of this work today. Today, I want to talk about World Sickle Cell Day. It's a World Sickle Cell Day. Let's talk about that disease. Could you please explain to us, Dr. Ochu, what is sickle cell? Because, growing up myself, I heard a lot about it, and we used to talk about, are you A or AS or SS? That was the much I knew growing up in Nigeria about sickle cell. But tell us a little exactly, what is sickle cell?
All right, thank you for that good question. Like today, I'm so happy to be here. You can see my t-shirt, because tomorrow is a World Sickle Cell Day, So I have some couple of, things I put up together, and it will take us like 10 minutes because I would like to go through it. And also, I would like everybody to pay attention, and I'll ask questions because asking questions is how we know that you have understood what I just, presented or something, So sit back and watch the presentation. Keep your questions because you also have to ask me questions, because if you don't ask questions, that means you not learn anything from it. All right. So let's look at the slide I have here today. If you can see my slide, I would like you to raise your hand so I will know you're seeing what I have here. Awesome, awesome. Okay, before we look at this slide, I would like to tell you a story. When I was trying to settle or get married as a young man, I had this girlfriend of mine, who was actually pushing for us to get married, So, and that's okay, fine. I will think about it. Just calm down. Okay, let's keep going, And I asked her a question one day because of the way she was pushing. I said, "What is your genotype? What is your genotype?" She said, "Okay, she will go and check that." She have not checked. I said, "Well, I'm AS. I've checked mine, So she came to my hospital. She did her genotype, and it was AS. And I said, "Okay, we have to go," because I always tell people, make sure you have a second opinion on your health issues. When you go to a place, they say this is what you have, or you have hepatitis, diabetes, hypertension, make sure you go to another specialist to confirm, to be sure you hear from the two specialists, for you to make a decision. Now, went to one of the best government hospital, she checked her. Again, it was AS. I want you to pay attention to this question because these questions will still go back to what we're discussing today. It's all about the awareness we're trying to create. So when she checked, it was AS, and she came back to home. I said, "Okay, now what? What do we do?" He said, "Oh, we have to go ahead. There is a way." She'll meet her pastor to pray and all that. I said, "Okay. Well, for now, I don't think there's any way out from this, After a week later, she came back and said, "Oh, she has talked to her pastor. Her pastor said we are going to pray and everything will be fine." I just laughed. I just laughed. I was like, "Wow, this is the funniest thing I've heard this year." Okay, because I believe in miracles. I'm a Christian, right? But there's some miracles I believe that can come from God, but not just scientific miracles, something that have to be prevented from occurring, not just, trying to give a trial so you can go to church or whatever, Oh, so back to what we are going to discuss today. So I made this slide for me to educate some people today because it's very important for us to know what is sickle cell is all about, okay? So today we're going to look at the contents, which is introduction, definition, etiology, epidemiology, the types of complications, and the diagnosis and treatment and prevention and conclusion, okay? So you ask a question, what is sickle cell disease? So the sickle cell disease is a group of inherited red blood cell disorders caused by when an offspring receives one sickle cell gene from both parents, or when an SA genotype decides to have children with an AS genotype. This is my own layman definition. This is the way I do explain when I go to the communities, in neighboring communities in Florida, Miami, for them to understand what genotype is all about, sickle cell anemia is all about. But let's look at the CDC definition, okay? CDC definition says sickle cell disease is an inherited blood disorder that causes sickle-shaped red blood cells that can stick together and lead to blocking of blood flow and oxygen from reaching all parts of the body. Now we have known what sickle cell disease is all about. If you can make a note, write it down, because I'm going to ask you some little questions at the end of this presentation. Now, it's good that we know the causes, the etiology, how come about the sickle cell disease, that has become a public health challenge. Sickle cell, I know if you don't have a medical background, you might not really understand this, or if you're not into, you don't have biology or biochemistry background, but if you have any question, let me know. I will break it down to our understanding, okay? Sickle cell disease is an autosomal recessive disorder of a gene mutation. On chromosome 11, nucleotide mutations leads to substitution of glutamic acid for valine at position 6 on the beta globin subunit. This leads to the change of the physical properties of the globin chain, many inciting factors which leads to the physical property change of the red blood cells. Red blood cells becomes more rigid when there is a release of adhesion molecules, causing interaction of these deformed sickle red blood cells to the endothelium. This is what happened before the disease takes place in our system. So let's look at the risk factors, because it's good that we know about these risk factors of sickle cell disease. Hypoxia, dehydration, exposure to cold, weather changes and stress, and infection. So what do I mean by hypoxia? When there's a low oxygen in the blood, it can trigger the sickle cell, somebody who already has the threat in his or blood. Low glucose, low oxygen in the blood can trigger it. Dehydration, sometimes we'll ask them to sickleers to always make sure they should not go hydrated, because they need to be taking fluid, have a lot of fluid, electrolytes, to be balanced in their system, in order to go into the crisis. We have some families, that we have seen sickle cell cases, some of our friends, families, and all the rest, we know that whenever they're exposed to cold, the crisis, will take place. So we advise them to be in a warm place, for them not to, always fall into the crisis every time, okay? Awesome. So infection is very important to talk about, When we talk about infection, there's different types of infections. And more especially the common one, which is malaria, which is a parasite, Anybody that has a sickle cell, they are prone to malaria, and when there's a malaria, if it's not being treated very well, they'll fall into the crisis which we are trying to avoid. And the crisis, I'm going to mention the complications, very soon for us to understand the crisis I'm talking about. Okay. So, awesome. So we cannot talk about sickle cell without talking about the epidemiology. Very, very important. As of 2021, about 7.4 million people have sickle cell disease, and 48 million are estimated to have sickle cell trait in 2015. This is the reason why we need to raise the awareness now, because it's very important in our Black communities. The prevalence of the disease is still precisely unknown, but high among the people of sub-Saharan Africa, South Asia, Middle East, and the Mediterranean. The most common genotype is homozygous hemoglobin, which is SS we all know about, And they might interest you to know that 101 in 500 African Americans children, they have sickle cell, and 1 in 36,000 Hispanic Americans children are also diagnosed annually. There is no reliable estimate of global sickle cell disease rate due to the poor awareness, the health disparity, the disease for the Black. I remember when I was delivering a speech, I was making a presentation to medical students, in FIU, Florida International University, I talked about the disease that's, because we believe so much that sickle cell anemia is disease for the Black, it can never happen in America, So I didn't want to talk about that because, when I was talking about it, look as if I'm trying to bring in ethnicity disparity and all that, So, but I have to advise them that it's good that everybody have to check before you get married, know your genotype, which is first step for the prevention. Very, very important, okay? So back to the epidemiology. In the United States, sickle cell disease affects approximately 80,000 to 100,000 people, and 1,800 to 2,000 infants are born with sickle cell each year in the States. Among the newborn American infants, sickle cell disease occurs in approximately 1 in 36 blacks, 1 in 4,400 to 1 in 36,000 Hispanic, and also 1 in 80,000 white. So I call these as a sickle cell disease pictogram, for me to use and explain very well what I mean, If you look at the diagram I have here, the picture, you see people who inherit one sickle cell gene and one normal gene has sickle cell, they have it in their blood, the trait in the blood. And people with the SCT usually do not have any of the symptoms. They don't know because there's no way you can show unless if you go to test, for you to go do blood work for you to find out that you have the trait in your system, They can pass the trait on their children. Yes, they can easily pass. If you look at this, I don't know if you see what I'm pointing, this is the parents, this is the mother, this is the father, you can see unaffected cardia, they have the trait in their system, but they don't know about it, they don't know they have it. They can only find out when they have gone to do blood work to find out. And also the mother, is also a carrier, but unaffected, there's no signs, there's no symptoms, or why one of the children, is there's 1 in 4 chances that one will be unaffected. There's also 2 in 4 chances that the other one will be unaffected, likewise the last person who is affected. So this is a good question, for us people have been asking, I myself have been also asking this question when I don't know what is sickle cell, because, well, I would say I got to know about sickle cell because I had a friend, my best friend when I was in primary school, his name is Ibokwe, we always drag who would take the first position in school, So when I started beating him was when every time he would miss some assignments, he would not come to class, So I keep asking what's going on, until we found out that he's a sickler. He's a warrior. He saw rest in peace. He's late now. Okay, so he stopped coming to school on time. He wasn't concentrating, so I was beating him, taking the first position in school. But I got to read about sickle cell then, to know what it's all about because it happens to my friend. All right. So back to the question, how is he inherited? If both parents have sickle cell traits in their system, okay, there's 50% or 1 in 2 chances that any child of theirs also will have the SCT. If the child inherits the sickle cell gene from one of the parents, such children will not have symptoms. Remember, they will not have symptoms unless they check. But they can pass the SCT on their children, on their own children, when they produce offspring. If both parents have sickle cell, trait, there's also a 25% chances or 1 in 4 chance that any child of theirs will have the sickle cell disease. Very important for us to know. It is the same 25% or 1 in 4 chances that the child will not have the sickle cell. Now, let's look at this graph, and the table. We actually have been trying to research on this sickle cell right from for a long time now. There was a time I had some of the, I'm trying to conduct a research, because I keep asking myself, why is the awareness too poor in Nigeria? My interest is to know that Nigeria has the highest case of sickle cell globally. And I keep asking myself, why is it that, someone can come out and say, I'm an activist, that is a celebrity, he cannot talk about sickle cell in your country? Because this should be a priority, for saying that you're an activist or a celebrity where some people can listen to, or people can hear when you talk, you have large followers on your social media and all the rest. Why not use it to talk about this sickle cell anemia to prevent so many families from falling into this crisis? you know. So on when doing my research, I found out that Nigeria, they don't even have a kind of, there's no precise data. They don't even keep data. You know, so I'm saying this not because I'm not part of Nigeria, but I'm saying this for us to, you know, see how can come in to help in our country in data aspect, you know, medical aspect of data is very important for us to, you know, because if there is an outbreak of a disease or something, you know, for you to start up a passive surveillance or active surveillance, data has to, you know, play a lot of information for you to know what to do and when to stop the surveillance, you know. So let's pay attention to that. Is very, very important. So as you can see, the first case that was noticed in America was 1970s. You know, it was a child that belongs to African American residents or citizens. You know, so that was where the awareness started from in US. You know, so looking at the graph, you can see I'm going to rush it because of time. You know, but look from 1975. You know, you can see the figure. It rises to the 2006. You know, when they start paying attention to sickle cell disease. Okay, now currently all 50 states and DC conduct universal screening of sickle cell, which is very important, you know, even after birth, before pregnancy, before birth, during antenatal, you know, that is the reason why we say people should register when you're pregnant, okay, even if you don't know your genotype, but it's good for you to register antenatal, okay, very, very important, you know. Let me talk about this antenatal very well. It's very, very, very important. You know, when I was working as the OB/GYN in Africa, I tell people, see, once you discover that you are pregnant today, the next step for you to do is to register for antenatal. Very, very important, you know. And, you know, in Western world, a lot of, you know, investigations will be done, you know, like here, if you see any pregnant woman, for the first visit, you have to do so many tests, so many blood works, you have to do even genetic tests. But we don't test genetic tests in Africa. So how do we know if this baby is a pre-candidate of a sickle cell anemia? How do we know? You know, so the only best way to know is for you to know your genotype before you propose, or before you're about to start making you know, making a family, you know, that's the only way we can know, because nobody, I repeat, the reason why we have high prevalence of sickle cell anemia is very, very on the high side in Nigeria, because we don't do genetic testing, okay? So please know your genotype before you decide to start producing babies. Very, very important. All right, so these are the figures I discovered, you know, when we are doing, you know, trying to look into some other countries in Africa, you know, to know the rate of the, you know, the figures, you know, or the data of sickle cell. So you can see we have in Nigeria, like I said before, we have 91,011. We are topping the game. Okay, so very soon they're gonna give us the World Cup. So Congo is 39,743. You know, Cameroon, Angola, Zambia, Ghana. Now, the world population is the world, you know, the global rate of people diagnosed of sickle cell anemia is 305,775 people. All right. What are the complications? Very important. What are the complications? Types of complications. You know, sometimes, you know, they will call for emergency, you know, when you come to see the patient, and like I said, it's always African-American, you know, child, you know, coming up with complications here and there, you know. I begin to wonder why, I mean, like, you know, sometimes I know it's not professional to say this, but sometimes you feel like, oh, today the call is not gonna be hectic, let me relax more. They just call you for an emergency and just come. Is case that is preventable. You say to yourself, why? I mean, well, actually, let me not talk about it because it's unprofessional actually, but this is the reason why we need to keep the flag going to let people know what sickle cell is all about and the reason why we have to, prevent it, from occurring. Awesome. All right, so let's look at the aplastic crisis, which present with a sudden pallor. When you see sickle, see their eyes are looking, from their eyes, the weakness could be a sudden drop in the hemoglobin level. That's the reason why some of them will transfuse them. Whenever we see them, we'll try to transfuse them because the shortage of blood, the lack of enough oxygen to carry the blood for the blood to function in the system, So, and also the shortened lifespan of the red blood cells which results in the worsening of the patient's baseline anemia, This is the father of all this vaso-occlusive crisis. This is basically, what makes them to, be in pains every time, When I see a chronic sickler, you don't need to tell me because when I look at the cubicle foci, I see signs of injections because they inject themselves with pentazocine, They have become addictive to pentazocine. It's an injection, Actually is a strong. I would say is an, I wouldn't say is a banned medication, but no. But the reason why we don't actually like people to inject it because of it has the same side effect with someone that's taking cocaine or other hard drugs, But when they inject that pentazocine, they feel the feeling, the ecstasy, the way they feel, because the pain will just disappear, and there's nothing will happen again. They can even walk with their legs where they're having the pains or do a lot of stuff, But because of the feeling, because of the feeling they get from injecting the drugs, they have become addictive, and the side effect of the drugs is more dangerous compared to the pain you're trying to solve. So that is the reason why we don't advise people to do self-medication. Okay. Now, the reason why you see them in the hospitals, the warriors, I call them warriors because of this, when they start having this complication, which is a vaso-occlusive crisis, the pains, in fact, the pains is something, I mean, if you want to rate the pains, they can rate it from, 100 over 100, because at that point, they are ready to do anything just to stop the pains, So it is one of the common types of sickle cell disease with variable intensity and the frequency of pain. The pain can start from 6 years old diagnosed patient, and also children that have severe pain and swelling of the both hands, feet, which is called dactylitis. Pain can begin from any part of the body, but frequently affect the extremities, back and chest area. And it can also be accompanied, with fever. The next complication I want us to look at, very important, is the acute chest syndrome. This can cause one of the causes of death, early death in a sickle cell disease patients. This acute chest syndrome, it accounts for 25% of death, and can follow by the vaso-occlusive crisis. The trigger for this acute chest crisis is hypoxia, like I've mentioned before. Hypoventilation, I've talked about this before, if you can remember. Okay, so the next complication that is very important to have to look at is the hemolytic crisis. Hemolytic crisis. I've had a case of sickle cell disease where the doctors were giving analgesic. I was like, hell no, this cannot stop this pain, because they have given all they could to give the patient to calm down, but the pain was still there. When I look at the patient, just physical examination, I was able to tell them, hey, we need to transfuse this patient right now. After the transfusion, the patient became fine. Just 1 pint of blood, the patient became fine. We have to discharge it. I said, discharge. Why giving painkiller and it's not working, So that is the reason why we have to be, careful in our management. It's very, very important, okay? All right, so this is also common, the femoral and humeral health. When there's I have an X-ray of a patient, but I wouldn't like to, because of HIPAA law, I wouldn't like to show it here. But we'll have a case, a common case like this, we're managing, but I don't want to show it here. Okay, I thought about it, but there's no need of showing it. All right, so diagnosis. Okay, how do we diagnose sickle cell disease? Very, very important. I remember back then in Nigeria, there was a case of a woman that, it happened in Akwa Ibom. Yes, the woman, they chased the 6 years old baby away. That the baby is a winch, because of the way the baby is looking. They chase the baby away, that, oh, he's a witch, and that, all these Nigerian superstitious belief and all that. So, and I came for a conference in Uyo then, so someone told me about the baby. I said, no, let's go and see the child. We went there, looking at the child, I was able to, make a spot diagnosis. There's a level you practice in medical field. You don't even need to start, okay, do this investigation. You just look at the patient and make a diagnosis, But for confirmatory, to confirm my impression, I asked them, okay, go to the hospital, do some tests. Some tests were done, and the patient is we diagnosed the patient the same sickle cell anemia, So the golden rules for you to diagnose sickle cell anemia is by testing. Okay, don't forget that. Very, very important. Okay, right. So sickle cell can be diagnosed through a thorough history. Yeah, from the history, but only history cannot give you. You cannot come out and tell me or tell a professional that, oh, this patient is a sickler, without doing examination, routine laboratory examination such as CBC, complete blood work with differentials, with leukocyte count, and the complete metabolic panel, including liver function tests. All these investigations are very important for you to make a diagnosis. Okay, so furthermore, since you cannot do all the tests in Nigeria, but if it's in Africa, because I know we have different people from different countries watching this, okay? If you're in the Western world, it's advisable. The school of thought said you have to do all those tests I mentioned, okay? But whereby you don't have the equipment to do all the tests, can do improvise, do the ones you can do, and judge from the experience as a doctor to diagnose the patient, okay? All right, so these are the, I've mentioned all these tests, X-ray, chest X-ray, CT, if our patient is, can do MRI brain, and all the rest. All right, treatment, very important. Before I start talk about the treatment, please, I would like to advise, okay, self-medication is not good, okay? I know some people like, from where I'm coming from, I know people like self-medication, things will be happening, someone wants to, I don't know if it's financial constraint, I don't know if it's poor health information, I don't know whatever it is, but self-medication is not proper. I tell you, almost 90% of people who are warriors, the sickle cell anemia patients in Nigeria, they do self-medication. All they do is to go to the chemist shop to buy pain relief, And when you keep taking medication, especially pain relief, without prescription, you're causing more harm than good. Yeah, in fact, you're causing more problem for yourself. Today we talk about. I don't want to digress from what we're discussing about, but when we talk about there are so many chronic kidney disease in Nigeria. These are the reasons: self-medications. Okay, but that should be a topic for next time, because I'm not really happy with the figure going up in Nigeria with the chronic kidney disease. It's alarming. Okay, so please, if you are the type that do self-medication, please mark to this date, you're gonna repent. Okay. All right. So routine medication, like I said, is very important. We have routine medication we give sickle cell patients. The routine medication is very important. In fact, I was one of the committee that championed the reason why government should give free drugs to sickle cell patients in Nigeria from 6 years to 12 years. They should receive their drugs free of charge. Why will you charge money for the drugs? They are going through a lot already. Okay, so luckily they absorbed the policy, but I don't know if they are still doing it right now. All right. So depending on the history, the complication, like I always tell people, treat according to the symptomatic the symptoms, because sickle cell, if you ask me, I would say it has no cure. Okay, and how many of us are ready to go and do the stem exchange in the bone marrow? It's expensive, and the failure rate is too high. Okay, so why not prevent than to go and attempt? Why not prevent having the sickle cell anemia than to go and attempt? Because the rate of the failure is high, and also is in fact, if you ask me, I would say there's no cure for now. Okay, yes. So treat, I tell my doctors, treat according to the symptoms. Patient comes in like, oh, I have a pain here. Treat, okay, hydrate the patient, and also if it's blood transfusion, transfuse, and more especially reassure the patient. Very, very important. Okay, try to talk to them, counsel them, let them not feel that the war has ended, or this, I don't know, like I remember one lady, she was a youth corps member then, she was like, why would they do this kind of a thing to me? Why would this happen to me? So I was like, it's not the fault of your parents, okay? Now that you're a warrior, go out there, talk about sickle cell anemia, talk to people, create awareness, join us in this, in this game. Let's step up our games, to create more awareness. So don't blame your parents, it's not their fault. All right, so they depend on the rapid pain assessment, and the initiation of analgesia should be undertaken promptly. Just treat, keep treating, and make sure you counsel them first, which is very important. Okay. This is not, I just put this in case of if there are some doctors that that medical doctors are here, so they can see this is the current treatment. This is the current treatment to have now, because some people are still using all these archaic method of treating sickle cell anemia. We have gone from that area. So this is what we use currently now to treat sickle cell disease. Okay, so I'm going to, if you want to get a copy of this presentation, let me know. I can send you a copy. Okay, and also, since tomorrow is Sunday, which is the World Sickle Cell Disease, please talk to your pastor. Let them put this slide tomorrow in the church so that people can see. Very, very important. We can't keep preaching about prosperity, repentance. Why people are dying. I think this should be the topic of tomorrow. In our churches, please, very, very important. Okay, all right. So the next thing we have is, I've already summarized this treatment, okay? So let's look at the public health needs, okay? The public health needs, we need more trained physicians, in that field, in that sickle cell field. We need more health facilities to be well equipped, to be well equipped, Also, we need public awareness. Please, at the end of today's presentation, I would like us to go out there, okay? Or let me know if you need this t-shirt, I can get one for you. Go out there, please talk about sickle cell. Talk about sickle cell. I want us from now to by this time next year, let's reduce the figure globally, please. Let's reduce the figure, okay? And also we need accurate data, very, very important, and estimate of health indicators. We need to increase the utilization of effective intervention, very, very important. High quality coordinated care for children and adults living with sickle cell disease. Okay, very important. I've sent in a proposal I sent to the World Health Organization. I was like, okay, can we place people that the sickle cell disease patient, can we place them on stipends, like maybe monthly stipends, that will encourage them to be taking their medications, just like we're about to do right now in HIV. We want to go to the rural areas, people that are diagnosed, to be giving them like stipends. That will encourage them to be taking their drugs, because we want to zero HIV, before 2030, okay? So I hope the proposal will fly, because it's very, very important that if we achieve this, since we still have minimum number of people that are suffering from this sickle cell disease. Now, if you look at the last slide I have, that say awareness, 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 awareness. Very important. I've told you guys before, if you want me to beg you, I can beg you to please keep preaching about sickle cell awareness. Keep telling people about it, okay? We have prevention, have 3 types of prevention: primary prevention, secondary prevention, and tertiary prevention. Now, what is primary prevention? Primary prevention, as an epidemiologist, I will tell you that primary prevention is when you create awareness about a disease, like as we're discussing sickle cell anemia now, when you keep talking about the reason why someone should check the genotype before they get married, okay? You are creating a primary prevention, okay? When you subject people to go for screening, you are doing the same work, which is very important. Please, awareness is very important. And when you're creating awareness, you're also preventing the disease from occurring. You see why it's very important, okay? All right. You can see awareness, awareness, awareness. Please, we need more activists in this field. Okay. Under prevention, which is one of the very important parts we need to know, is the primary prevention, like I've said before: counseling, testing, know your genotype before planning to get married. Secondary prevention, regular checkup, routine medication, keep hydrated, know your blood level, and treat malaria often. And tertiary prevention, like I've said here before. That, in conclusion, please, sickle cell disease is a global challenge, okay? When they say it's only for Blacks, don't listen to them. It's a global challenge, okay? So don't allow someone to talk you down that, oh, it's only for Blacks. No, we have seen so many cases, not only for Blacks, all right? Okay, in the Western world, people are often surprised when they learn that a person who is African-American has sickle cell disease. That has been happening, okay? But I tell you, we are working very hard, to bridge that health disparity, in America. We are working very hard in that, okay? All right. Okay, all countries must work together to solve this global problem, because the warriors are going through a lot. How many of you have seen someone that is in crisis, a sickle cell disease patient? How many of us have seen one? Okay, there's a need for all of us to work together globally, okay, to do something about it. Okay, I'm about to round up now, okay. Join Doctors on Call in the fight against sickle cell disease and the training of health workers to combat this lethal crisis. For more information, you can visit a foundation and all that, okay? Thank you so much for listening. Back to any question for us? Before I ask my question.
And thank you very much for that amazing presentation. We have someone, Fatima, who just says, I am a warrior. It's not really easy. Thank you very much for sharing that. Somebody else, Wunna also says, I'm one, the feeling is hell. I always die and resurrect. That talks about the pain that they go through. It's got to be excruciating pain. I'd like to ask you a question that I saw earlier on the chat room about the difference between, there's another disease called, the person wants to know is thalassemia, beta thalassemia, is it the same thing as sickle cell?
No, it's not the same. There are two different things, yeah.
Yeah, I actually looked it up myself, and I found out that thalassemia has to do with the disease that prevents the blood from making hemoglobin, right? So it sounds like a sickle cell, but it's not, right? But sickle cell is a deformation of the cell, which causes the cell not to have enough hemoglobin like a normal cell. And that means you can't really bind a lot of oxygen to
to function, right.
Okay, questions, please. And let's see, we have a lot of questions in the chat room. Somebody wants to know what causes deformation of the sickle cells.
Okay, I think I explained that here before, but let's go back to, so if the person is here, join me, let's go back here so I can explain it more further, okay? Yeah. So I talked about the etiology. Hold on. All right. It has to do with the blood, okay, the system, okay? That's what we call autosomal recessive disorder of the gene, okay? So when the beta global subunits, when there is a notification at the position 6, that's what we call position 6, okay, that leads to the sickle cell anemia in the blood. And when the blood is no longer able to function, the red blood cell will die off, So there's a shape, I don't know how to show, I don't have that shape of blood I would have used to explain very well for you to understand what I'm trying to say, okay? So mostly there's an adhesion at the molecular stage of the blood formation. So it cannot, that's one of the major part that leads to the sickle cell disease or the sickle cell anemia. So just for instance, the blood shapes are different, they're deformed. If you look at the blood under microscope, the blood cells are deformed. The normal blood will be round, while sickle cell blood will be like this. It'd be all I call this shape, like half of the spherical round. Okay.
Okay. Okay. Dr. Paul Iselin, go ahead, please. Any thoughts?
I just had a concern in terms of prevention. You talked about how people getting married should go have their blood checked, and that's important. But there's a lot of children that come, beyond or are extramarital children, right? So, how would you translate that to those who are just out here, doing their thing, having kids and having kids outside of marriage?
All right, this is a very good question. I think we're doing today, creating awareness, which is very important. When you create awareness, they'll be able to know that, hey, you need to check before, even if you want to, mistakenly or, taken, but at least there's a need for you to know your genotype, okay? And especially when you're into a relationship and it's becoming more intense, or you guys are heading, somewhere. I mean, there's a need for the man or the lady to find out the genotype of the partner or the friend or the boyfriend or girlfriend. I mean, that will help, to resolve that question.
All right, let's see. Sylvester wants to know, can sickle cell be treated, and also can the patient live a normal life? Is it possible?
Right. Well, a patient can live a normal life, if you are well educated, like if your awareness is, you're getting more awareness on how to manage yourself. I've seen people that are still living, living with the disease, they're doing very well. In fact, I have a colleague who's a doctor, he's a sickler, he's 56 years old today, So just know the risk factors and know what to do at the right time. Don't do self-medication. Visit a qualified physician or certified physician when you notice one or two things. Okay, you'll be fine. Trust me, you'll be very, very okay. Right?
Liz wants to know, can sickle cell disease female patient be pregnant and have safe delivery?
So say that again.
Can a sickle cell disease female patient become pregnant and have a safe delivery?
Sure. Yeah. I've had like 3 patients, sicklers, they delivered peacefully, Sure, you can.
Let's see here. Dr. Paul Easton again, feel free to unmute yourself and ask a question or chime in as you please. Let's see. So Okam wants to know, let's see, we hear a warrior can survive the disease and get to an old age if they live up to, say, about 30 years. Is that true? I think the question here really is, if you hit that 30-year mark, the possibility for you to then live longer increases. Is that the case? That's the question from Okam.
Yeah, Okam, yes. As long as you're taking care of yourself, doing the right thing at the right time. Yeah, the life, before they said the life expectancy of sicklers are below 40, but that's not true. Science has proved that wrong, okay? So just do the right thing you're supposed to do, hang in there, you'll be very fine, okay? I promise you that.
Yeah, I have another question here from the chat room. How can we stop stigmatization of people who have sickle cell?
Well, stigmatization is a very, very, when it comes to healthcare industry, is a very, very, I mean, we will try as much as possible to see how we can prevent or, to stop that, But it has to do with, exposure, if I may say, and how educated someone is, because I don't see the reason why you should, discriminate someone or, because he has 1 or 2 issues, Just like last year I was giving a head talk on HIV, so many people reach out to me from Miami, they were like, oh, I'm HIV positive, I'd like to speak, or I learned that you guys have a program, I'd like to speak. But when we had the same program in Nigeria, people, they were like, come on. I was also giving a head talk somewhere. I told someone, hey, listen, do you know that diabetes is more dangerous than HIV? He said it's not true. I said, really? I can prove that. I can prove that if you don't believe me. Because someone who is living with HIV can go to Sam's Club and buy a big bucket of ice cream, enjoy yourself. You can go out there to go and drink a bottle of champagne, But someone who is diabetic has his own limit, He cannot, you have to monitor your blood sugar. There's a way you can take that ice cream, you will enter into hypoglycemia immediately, There's a way you can take that champagne, sugar will shoot up, And above all, both of them, they will be on drugs for the rest of their lives. So why discriminating? What's stigmatization for? So I think this answer this question.
And there's also someone wants to know how can they get that T-shirt that you have. A couple of people want that T-shirt.
All right. Okay. Send me your email address. Okay, I will get your address and send you one. No problem. As long as you're going to follow us to create awareness.
This is from Precious. How often should a sickle cell patient take folic acid?
I think folic acid is one of the, I think it should be one of the routine drugs but I will check again, let me not give you wrong information. But there are 3 drugs we place them on, okay? You have to be on. Is a kind of routine drugs. Zinc, you have to have your zinc, every time. It's very important, And the folic acid, I will check again if folic acid, let me not give wrong information online, okay?
Sure. Yeah, that is actually a patient-doctor kind of question. Someone is trying to get a prescription almost. So yeah, I think we should skip that question for now. Maybe get a more accurate response. Goma wants to know, my network was poor for a while, so I don't know if you said anything about treatment. Yes, he did. Okay, yeah. Oh, yeah. Somebody wants to know about. Okay, she wants to know about bone marrow transplant as a solution. Is bone marrow transplant as a solution the case? And let me also add to that question. I got a text from this morning when someone saw the flyer that we shared, and this person actually lives in Lincoln with me. She said she has a friend who lives here in Nebraska who took care of the sickle cell situation of a family member through blood transfusion. So speak on again on blood transfusion and bone marrow transplant as solutions.
All right. Bone marrow transplant is a procedure, just to, the basic thing what we do there is just to remove that circular blood, that red blood cells, from your system, to change it to a new one, right? Which I said is very expensive, but the high rate of the failure, that's the reason why sometimes we don't recommend someone to do that, okay? White blood transfusion, the blood transfusion is basically when, is a kind of part of the treatment, like is management, not like a cure, okay, management. When your blood level is low, you have to transfuse you, because if you cannot get transfusion, there's no way you can recover from that crisis, the present crisis you are into. You need a blood transfusion, because the blood already in your system is passing through hypoxia, which there's not enough oxygen to carry out the blood to function, to do its functions in the system. So these are 2 different things.
So you see, what I'm hearing is basically the blood transfusion is like you're giving blood, healthy blood cells into the patient,
right,
to temporarily give them a supply of oxygen, right?
Absolutely.
But their bone marrow is still producing sickle cell, right? But temporarily you've transfused blood to help them, right?
Absolutely.
But then with the bone marrow transplant, again, just to make sure we understand clearly, are you trying to get the bone to start producing healthy?
Right. Yeah, take out the old one and, so I can start producing the healthy bloods.
Interesting.
Right.
Okay. So that's what you're doing. And that's why it's very expensive, and it can also fail. It could be fatal. Okay. Right. Interesting. Go ahead, Dr. E. Any questions or any thoughts?
I'm good.
Okay. So let's see here. Someone wants to know, Akbar wants to know, can a sickle cell carrier actually change to another genotype?
Okay, I think this is a very good question, because I've been expecting this question, for me to talk about experience. Okay, I was in let me tell a story, please, because that's the reason why I don't forget this question. I was in a church service Sunday. Someone invited me. I came to Nigeria, so someone invited me to a church. I don't want to mention the name, Someone came there, to give a testimony how pastor prayed for her, has SS changed to, AA, okay? Like I said, I'm not against miracle. I'm a Christian, and I'm a believer, But I said to myself, there is no way, no, this is not possible. Just like we see in the case of HIV, someone will go to a pastor will pray, they'll ask them to go for tests to confirm. They go to test, right? They will not see anything, the result will change. They'll come back to testify, I've been healed of HIV. But not knowing that the HIV went back, is suppressed at the moment, it's out of the system, it's in the bone marrow at the moment, Now, as time goes on, you stop taking your medication, it starts coming out again. Now, when you go back, by the time you have stopped your drugs, addiction has started, drug adherence has already taken place. When you start taking your drugs again, or when you finally you start seeking, go to the hospital to check, the HIV is still there after 2 years or 3 years or thereabouts. Now you have become a full-blown ex-patient, right? So I've never seen a case where SSS changed to AS. No, it has never happened before, or AA. I've never seen that case before, unless if there's a mistake from the lab. That's the reason why I said, don't seek for a second opinion when you are giving a diagnosis. It's good to find out. Okay. Now, before I forget, we have major 4 types of blood, or genotype. Okay. So it's good that we know this because I didn't mention about it. We have AA genotype, we have AS, we have AC, and we have SS. Okay. These are 4 important types of genotype that we have. Okay. So if you have not checked your genotype after today, please make sure you go on Monday and tell us what it is. Okay. It's good that you know on time. Thank you.
Thank you very much. And we usually end at the hour. We are 8 minutes over our time, but I'm going to let this continue because we have very high engagement. A lot of people want to know. We want to support you, Dr. Daniel Ochu, to create this awareness that you are campaigning for sickle cell. So let's continue. Let's get a few more questions in so that people can learn about this. I hope it's okay with the panelists, and I also want to thank our audience for being engaged. So, question from Nestor. Nestor wants to know: can someone overgrow sickle cell disease?
No, I've never seen in the years of practice.
Yeah. From Ugunda, how can one treat AVN necrosis of the femoral head without salt?
The procedure is surgical case, so it has to be through surgery. Drugs cannot.
What is necrosis? If you don't mind, tell us what that is.
Okay, necrosis is one of the complications of sickle cell disease. They pass through. Okay, it has to do at the head of the bone. The femur. It could be the femur. When there's a kind of let's say like a kind of wear out. Because of pressure on that part. So there'll be a kind of wearing of the bone from that place, because, the blood cells have to give nutrients for all this thing to function, okay? Because their bloods are not functioning very well. So there'll be a wear out, wearing.
Yes.
So the only way it can fix it by surgical, because an orthopedician who is a specialty in sickle cell have to go in, to kind of refine, to touch, that bone again. Then, take for instance, if the bone is dead already, or there's no way they can salvage it, they have to, put an instrument to support the bone.
But this is really, it makes a lot of sense because, oxygen is so important and vital for overall function of the body. So if any part of the body, any tissue is not getting a healthy supply of oxygen, it's almost like gets short-circuited. It's like you're starving that part of the body, so it can really die off. So that's, wow. I really begin to appreciate this presentation that you've given. Let's see, Dorothy wants to know, what is the life expectancy for sicklers?
Oh, this is a very good question because let me start with the general life expectancy. Am I interested to know that, I don't know where the person that asked the question, I don't know the country you're asking from, but I'm going to give you life expectancy of the Western world and the rural, world like Nigeria and other rest, Nigeria has the lowest life expectancy globally. We have 55. Imagine ordinary Somalia that has been fighting, that just came out from their, from the problem or country crisis. They came out from their, above Nigeria 58, when Nigeria is 55, And it's worrisome because you begin to wonder what will be the fate of someone who has sickle cell anemia or sickle cell disease, So I will answer the question by the last.
That's very important. You just made a difference. Yeah. So that 55 you just mentioned is not the life expectancy of someone who has sickle cell. That is just the life expectancy of an average person in Nigeria.
Right. An average person in Nigeria.
So it's going to be less. So go ahead, please, Doc. Go ahead.
So someone that has sickle cell disease, now think about the lifespan of the person, if care is not taken, it might be lower, okay? But if the person is, taking care of his or herself, depending on the location or where the person is, or how well or educated the person is, or the awareness about the sickle cell anemia. So it might be above that or lesser. So that's how I can answer the question.
I mean, this is, in fact, it just hit a chord in me right now. Again, thank you, Doc, for focusing on a lot of the diseases that affect Africa. This is what we are about too at Osiri University. There's a lot of diseases that affect Africa, often not talked about. I know it's a global case, just like malaria is also a global, but it's very prevalent in Africa. So one of the things we're trying to do at Osiri is to take do a study to figure out, okay, what are the diseases that are affecting our people, and how can we really help to bring research? I mean, we could even start by just sharing research that's already available, and we can start there. Just share those research to improve life. And what can we do to also improve life expectancy in Africa? It could just be something like water, sanitation, things. And we know these things have political hinges, because when the politics is not right, when leadership is not right, then infrastructure breaks down and people get sick. So it requires a multidisciplinary approach to solve, and that's what I'm excited about connecting with you, Doc. I know you want to say something about that. Go ahead, please.
All right. Like I said, sometimes I wonder why people should be dying from preventable illness, because one, if there's enough information which I still believe in, awareness, I mean, we can increase the lifespan of in Nigeria. Okay. So what they need to know is, hey, this is what you need to do at the right time. Now, let me tell you, for instance, we talk about breast, like we are going to do a breast cancer awareness day on October, Now, in US, if we give birth today, appointment will be set for immunization from day 1 till 12 years, okay? What we call HPV, which is a human papilloma virus, right? Very, very important. Some of the cancers today are being caused by HPV. Some of the cancers, cervical cancer, breast cancer, there are so many millions of HPVs that causes cancer, right? Now, only prevention, just take a vaccine when a child is, a girl is from 12 years, let's say from 8 years, we'll start reminding you about the appointment for the vaccine, which you have to take from at least before you clock 12 to 15 years, to just prevent cancer from occurring. But tell me, how many people have taken the HPV in Nigeria? No. Last time I asked the question, I went to present on cancer. I asked them the question: how many of you have been, immunized on HPV vaccine? They don't even know what I'm talking about. Now, how do you intend to improve the lifespan in Nigeria if you don't know the certain things, measures you have to take, preventable measures you have to take for you to, you know what I mean, for you to increase the lifespan, okay? So if you're here today, wherever you're watching from, I know if you're US, I know you must have taken it, but if you're a lady, a parent, you're a mother, and you're based outside the country, please go today or from next week to get a vaccine for your daughter. Very, very important. Okay. Thank you so much.
We have a lot of work to do, indeed, for our people
work,
in our community.
Hanatu,
here's the last question. Hanatu wants to know, she says, thank you, doctor. Please, can a mother know her baby's genotype right from the womb, even before giving birth to the baby?
Very possible. Very possible. The test can be done. Very, very possible.
Wow. Thank you again, Dr. Ochu. This has been an amazing informational session. For those of you who've tuned in, thank you also. Please feel free to drop your email with us so we can stay in touch with you, drop your number so we can connect with you via WhatsApp or via phone calls and things of that sort. To Osiri University, we are really coming together. We are to create solutions and to make the world a better place. That is our mantle. And we are open to working with folks like Dr. Daniel Ochu, who has a similar mission so that we can supercharge our efforts because we can't do it alone. We are very proud of you, Dr. Daniel Ochu. We are very inspired by you, by your humility, by your hard work, your hard work ethic that you brought in to help change the face of Africa. So thank you so much. Dr. E, do you have any remarks before we turn back to Dr. Ochu for his last word?
No, just thank you for informing us and keeping us informed in these things. Very important. Thank you, Doctor.
Thank you so much.
Dr. Ochu, the last words.
All right. Well, I must start by saying thank you so much for giving me the opportunity, at least to educate, some people. Education is power. It's good that we create more awareness. So, well, I'm here anytime you need me to talk more on any disease. I will avail myself. Thank you so much for this great opportunity. Thank you.
Wonderful. Thank you.
Thank you.
Ubuntu.
What's Mucho? Let me learn that.
Ubuntu, yes.
I'm glad Oh, okay.
I am because we are. I derive my humanity from you. That is what Ubuntu means.
Awesome.
Ubuntu. It's an African philosophy.
Awesome.
Yes. That is the motto of Osiri University.